In the past, it also used to be called as winter bug. And during the onset of winter, this particular infection used to cause stomach upset or nausea, vomiting, and gastroenteritis, more commonly in children and in elderly. Particularly, it is more common in southern states during this time of the year, and then gradually it can affect any of the region. The cases are, like I said, are not really on the rise. They have been there for many, many years, but it is being more frequently diagnosed and more frequently addressed now because of more awareness about this particular disease.
Hi guys, this is Minidevan and you're watching HealthSite and India.com. Today we have with us Dr. Puneet Khanna, Head of Respiratory Medicine, Manipal Hospital, Goa. Hi doctor, how are you?
Hi, good morning. How are you?
I'm great, sir. So, sir, the very first question that comes to my mind right now is if you could throw some light on what exactly is norovirus.
Well, yeah, so norovirus belongs to a group of viral infections that causes mainly abdominal symptoms or infection in the abdomen. In the past, it also used to be called as winter bug, and during the onset of winter, this particular infection used to cause stomach upset or nausea, vomiting, and gastroenteritis, more commonly in children and in elderly. And usually it is transmitted fecal-orally, which means through contaminated hands or contaminated foods. There is a transmission. Very common. It's a very common cause of viral gastroenteritis, and it's a self-limiting mild disease, but it's still quite common. And particularly, it is more common in southern states during this time of the year, and then gradually it can affect any of the region.
But why is it suddenly on a rise, sir? Especially in India.
Again, yeah. So it's because of the poor hygienic conditions, particularly at the countryside and the roadside. The most common cause of spread of infection is eating contaminated food or water from outside, and particularly after monsoon, there is always this mixing of potable water or contamination of groundwater with sewage water, and this is what normally causes the outbreak of such viral gastroenteritis diseases. The cases are, like I said, are not really on the rise. They have been there for many, many years, but it is being more frequently diagnosed and more frequently addressed now because of more awareness about this particular disease.
And to identify the disease, what are the early symptoms of norovirus?
The early symptoms are usually those that are very similar to that of gastroenteritis. Mainly, you have nausea, vomiting, loose stomach, loose gastroenteritis symptom, diarrhea sometimes constipation or bloating, feeling of bloating or pain abdomen. The symptoms as such are quite non-specific, but if they are accompanied by fever and if they resolve or if multiple people are infected in the household at the same time, then we should suspect that they could be having norovirus.
So when should one really visit the doctor?
So usually because these diseases are self-limiting, so there is no need urgently to rush. Only mild medications like paracetamol, oral rehydrating solutions, or clean water, these are more or less sufficient for control of the disease. In case the diarrhea or vomiting is persistent and is leading to dehydration, then they should get hospitalized or take a proper opinion.
अच्छा, और अगर किसी को हो गया है norovirus, if somebody is already suffering through the disease, तो what are the treatment processes and is there anything that a person should know in terms of treatment?
Usually, what people need to do is once somebody who's suffering from this particular disease, they should just visit the nearby hospital and take IV medications and IV drip in case they are severely dehydrated or get medical attention. Antibiotics as such has got no role in this particular type of infection, and most of the cases do respond very well to symptomatic treatment or symptomatic fluid management, and usually the outcome is quite okay in this particular disease.
And sir, anything that you would like to share with our viewers that the audience should keep in mind when it comes to prevention, if they can prevent the disease from their end?
Yeah, so prevention is basically keeping a good hygiene, eating healthy food, avoid eating outside during these times of epidemic, use hand washing properly because that goes a very long way, particularly children. They should, before eating and after visiting a washroom or restroom, they should wash their hands properly with soap and water.
All right. I think, sir, this has been fab and the audiences will go back home with lots of valuable insights. So thank you for that.
Thank you.